As we age, conversations about health tend to focus on the obvious: aches and pains, a slower metabolism, or the need for reading glasses. But the truth is, there are silent health risks that older adults rarely talk about, either because they don't recognize the symptoms, they're embarrassed, or they assume it's just a normal part of getting old. These risks, if ignored, can quietly turn deadly, shortening lives and stealing away years that could have been spent in health, happiness, and independence. If you or someone you love is over 60, this might be one of the most important videos you'll ever watch. Because today I'm uncovering 7 deadly health risks older people aren't talking about. And more importantly, what you can do about them before it's too late. Let's start with one of the most overlooked yet widespread threats: silent heart disease. Many seniors think chest pain is the only warning sign of heart trouble. But in reality, the heart often whispers before it screams. Shortness of breath after light activity, unexplained fatigue, or even a bit of indigestion can be early signals of blocked arteries or heart failure. The problem is, older adults often brush these signs off as just part of aging, but they're not. A silent heart problem can turn into a fatal heart attack or sudden cardiac arrest without warning. Studies show that nearly half of all first heart attacks are also the last, because people didn't know they were at risk. The solution? Regular heart checkups, blood pressure monitoring, and not ignoring those subtle symptoms. Your heart deserves your attention, because once it fails, there's no turning back. The second deadly risk is something far less dramatic, but just as lethal: falls. People underestimate how dangerous a simple fall can be. For a younger person, a trip on the rug might leave a bruise. For someone over 65, that same fall can lead to a hip fracture, internal bleeding, or traumatic brain injury, and sadly, many don't recover fully. In fact, falls are the leading cause of injury-related deaths among seniors. Yet this is rarely talked about because no one wants to admit they're becoming frail or unsteady on their feet. But denial doesn't stop the danger. What helps is taking preventive steps, strengthening exercises, removing household hazards like loose rugs or clutter, and regular vision checks. A strong body and a safe home can literally save your life. The third silent killer is chronic dehydration. It may sound harmless, but as we age, our sense of thirst weakens, and we stop drinking as much water as the body needs. This leads to thickened blood, kidney stress, urinary tract infections, and even confusion that can mimic dementia. Some older adults don't want to drink much because they're afraid of frequent bathroom trips, especially at night. But dehydration can spiral into deadly complications, landing people in the hospital for something entirely preventable. The body is made up of nearly 60% water, and it doesn't matter if you're 20 or 80. Your cells still depend on hydration to function. Keeping a water bottle nearby, sipping throughout the day, and balancing fluids with electrolytes when needed can keep your body resilient and sharp. The fourth health risk is one we whisper about but rarely address head-on: mental health decline. Depression, anxiety, and loneliness are rampant among older adults, but because of stigma, pride, or fear of being a burden, many keep these struggles hidden. The danger is that untreated depression isn't just about sadness, it's linked to higher risks of stroke, heart disease, and even faster progression of Alzheimer's. Loneliness itself has been compared to smoking 15 cigarettes a day in terms of its effect on mortality. Think about that for a moment. Staying socially connected, seeking professional help when needed, and not being ashamed to talk about feelings is crucial. Emotional well-being is not a luxury in old age. It's a lifeline. The fifth silent but deadly threat is sleep apnea and poor sleep quality. Many older adults think snoring is just annoying, but sleep apnea actually stops breathing multiple times per night, starving the brain and heart of oxygen. Left untreated, it dramatically raises the risk of heart attacks, strokes, and even sudden death during sleep. The frightening part is that many don't even realize they have it because symptoms like fatigue, morning headaches, and irritability get blamed on age. But sleep isn't optional. It's the time when the body repairs itself. A simple sleep study and the right treatment like CPAP or lifestyle changes can restore not only rest but years of life expectancy. Ignoring sleep issues can literally take your breath away in the most permanent way. The sixth risk is hidden infections and inflammation. Urinary tract infections, gum disease, or even untreated colds can spiral into sepsis in older adults, a condition where the body's immune response goes haywire and starts shutting down organs. What might seem like a minor issue for a younger person can quickly become fatal for someone whose immune system is already weakened. Yet because infections don't always present with obvious symptoms in seniors, they're often missed until it's too late. For example, confusion and delirium are often early signs of infection in older adults, not just forgetfulness. Staying on top of dental health, hygiene, and regular medical screenings is not just about comfort. It's literally a shield against deadly complications. Finally, the seventh risk is medication mismanagement. As people age, prescriptions pile up. Blood pressure pills, cholesterol meds, painkillers, sleeping aids, and more. But when taken incorrectly or when one drug interacts with another, the results can be deadly. Medication errors send thousands of older adults to the emergency room every single year. Yet few want to admit they forget doses, mix pills up, or skip them altogether. Sometimes seniors even take over-the-counter remedies that dangerously clash with prescribed medications. The solution here is organization and communication. Pill organizers, setting reminders, and reviewing all medications with a doctor or pharmacist regularly. This simple step can prevent accidental overdoses, internal bleeding, or organ failure caused by drug interactions. When you add all of these risks together, silent heart disease, deadly falls, dehydration, mental health decline, sleep apnea, hidden infections, and medication mishaps, they paint a sobering picture. These are not rare problems. They are common, they are preventable, and they are silently taking lives every day because we don't talk about them enough. The tragedy is that so many older adults suffer in silence, thinking these issues are just part of getting old, when in reality there are red flags that demand attention. But here's the good news. It's never too late to take action. Awareness is the first step, and small changes can have massive impact. Drink more water. Keep moving to strengthen your balance. Don't ignore your heart, your sleep, or your emotional well-being. Speak openly with loved ones and doctors. And above all, don't let embarrassment or denial keep you from addressing health concerns that could save your life. If you've made it this far, it means you care about living longer, stronger, and with more joy. And that's exactly why I made this video, to shine a light on what too many people keep in the shadows. Your health is your most valuable asset, and you owe it to yourself to protect it. So if this message resonated with you, share it with a friend, parent, or grandparent. The conversation you spark could be the reason someone you love gets a second chance at life. And before you go, I'd love to hear from you. What's one health change you're committing to today after learning about these hidden risks? Drop your answer in the comments. And don't forget to subscribe for more life-saving insights that can help you or someone you love live not just longer but better. Because growing older is not the problem, it's ignoring the silent dangers that is. Let's face them head on together.